for some doctors who were struggling, once they started innovating or doing other things, sometimes you have to feel better outside medicine to feel better inside medicine, which is the title of one of our chapters, which I believe the both of you are doing even by this podcast, right? By doing this, sometimes doctors, whether they became coaches or started a side venture, whatever, that filled their cup in a way that they had renewed interest in practicing medicine. So, and then there's also doctors who are like, this whole thing is ridiculous. The system has to change. And some of them do have the bandwidth to advocate for system change.
I'm going to share an experience that was very frustrating in the past couple days that has been really, really frustrating me. So, part of my job, I cover multiple patients in different states, and there's this kind of we have the interstate compact licensing. The point is that you apply to that, so then it's easier to add more states, so you don't have to do credentialing and fingerprinting and all these things for every single state. So the initial application, of course, it's very comprehensive, lots of verification processes and all that. So I did that last year, and I was granted the licenses, and I added more licenses, and then now it's time for renewal. And I was shocked to see that that particular state is requiring me to go get fingerprinted again, to go send all my verifications again. I've been on the phone with them for the past 3 days, and they keep saying, "No, yeah, we require it again and again." And I feel like I'm being treated like a criminal. And it's a very frustrating situation because they give you a timeline. They say, "Oh, you have, it's 4 weeks until you renew, okay?" And then just the background check takes 3 to 6 weeks, according to them. So I'm not sure what physicians can do in these situations where this administrative burden is expected, but also some of this I'm at the mercy of, you know, of the fingerprinting processing. I'm at the mercy of other states to send, you know, my board certifications directly to this other board that they want my board certification. So I'm at the mercy of a lot of these people that they have to do their job for me to be able to take care of my patients. And this is a renewal,
Right.
that means I have patients that are waiting for me to be seen as follow-ups in the state and all other states that are connected to the states. And I have to tell you that that last night I was, I told my husband is that I can't wait for the day that I am done with all of this processes, because it's really unfair that everything is online. I feel like these are just obstacles that are placed in front of physicians to just control. It's just control and lack of autonomy, because everything is online. I've already, they've already verified my board licenses. They've already verified that I trained. They all of this is I've been practicing for all this time. So if it wasn't verified, how could I even have an active license and practice? But no, I mean, it's just they're like, yeah, this is what we require, and that's it. It's just there is no other, you cannot even do anything, which I felt like helpless. I felt I didn't have control, and I felt like really I was treated like a criminal. Or another, healthcare system. I'm not going to name names, that I'm credentialing for, and I had to. Go for a drug test, which is very typical. All of us, we go for drug tests. So I went to the lab, and in the lab, it says drug test, breath test, and hair test. So I had to sit there, and even the lab technician was shocked. She said, "What is this for?" And I told her I'm a physician. And so she had to cut multiple areas, multiple patches up from my hair in multiple areas, because that's the requirement for that healthcare system, to send it to them. And also, that will take a long time for the process to happen. And I'm thinking to myself, you know, really, the only people who do this is criminals, is criminals who have to go give hair samples. Um, it's just too much. A lot of us physicians are feeling exhausted with this. We're just trying to take care of patients. We're doing the best that we can. I mean, all we want to do, we are good doctors. We want to take care of our patients. We are just experiencing obstacles after obstacle and after obstacle. So many of us, they just give up. Many of us just they don't want to practice medicine anymore. And they're like, I'm not going to do this anymore. I can't do it. So it's very, very exhausting, as you said. I'm so glad that you are really advocating for physicians and you are helping physicians to stand up, because if we don't have a collective voice to say no, we're not going to get anywhere. Really, we're not going to get anywhere. So what advice would you give the doctors who are struggling like this silently?
Right. So there's a couple of things I want to touch on. One, to what you just said is yes, that is absolutely ridiculous. And what it brings to mind is you're familiar with the Dr. Lorna Breen Heroes Foundation. Yeah, so she was an one amazing ER physician who died by suicide during the pandemic because she got COVID, went back earlier than she should have, gone back, but she was just trying to take care of patients, working very long days. So she had an emotional breakdown. Her sister and brother-in-law, Corey Feist, who was a lawyer, got her help. They brought her to Virginia, but she thought that everything she worked for, she would lose because, you have the intrusive licensing questions on the back of your license. Where me as a physical therapist, mine just says, like, have you ever been convicted of a felony and did you complete all your CEUs for the year? But physicians have to, have you ever sought help, or, for help for mental health support? And she knows she'd have to, now check yes. And a few days after she was discharged from inpatient stay, she took her own life because she thought her career and everything that she worked for. So the horrible thing is I believe she didn't know that New York had already removed those intrusive licensing questions. So that just kills me. But the doctor, so they formed her sister and brother-in-law formed the Dr. Lorna Breen Heroes Foundation to make it safe for healthcare workers, doctors, nurses, pharmacists, healthcare workers to seek mental health support that's safe, confidential, all of those things. So they have certain, like pillars that they're working towards. And on their website, drlornabreenheroesfoundation.org, they have a map to show all of the states where they've successfully removed the intrusive licensing questions. So that's just one thing that they've done. And they've made very good progress in a relatively short period of time. So even though it shouldn't take this, there might have to be, and again, they aren't physicians themselves, but either to have people that support physicians or physicians that do have the bandwidth for now might have to stand up for certain things, like you were just speaking to, Shala, like that recertification, every year, or whatever, relicensing, like that. That's excessive and ridiculous. But you would need enough people, or right people, to stand up and say, no, this isn't right. And sometimes it takes legislative changes. But when you're an exhausted physician just trying to keep your head above water, you aren't in that space. So I feel like there's doctors in a continuum. So there are doctors that are struggling, and it's almost surprising to find that doctors aren't. Right now, I think during the pandemic, like 65% of doctors were burnout. Now it's around 50%. So it's almost surprising. Well, and we need to hear from the ones that aren't. How are you doing this, right? So we do need to support doctors who are struggling, and that's my primary interest. Related to that is sometimes doctors feel like I'm just a doctor, or I'm only supposed to be a doctor, or it's not appropriate to do anything else besides be a doctor. But for some doctors who were struggling, once they started innovating or doing other things, sometimes you have to feel better outside medicine to feel better inside medicine, which is the title of one of our chapters, which I believe the both of you are doing, even by this podcast, right? By doing this, sometimes doctors, whether they became coaches or started a side venture, whatever, that filled their cup in a way that they had renewed interest in practicing medicine. So, and then there's also doctors who are like, this whole thing is ridiculous. The system has to change. And some of them do have the bandwidth to advocate for system change. So I communicate with doctors in all of those buckets and people working in all of those buckets. So I'm still trying to figure out, like my own model is how I can create the biggest impact in supporting all of that. But speaking to your point is a message for a doctor who is struggling. It's not just you. You're never alone, and there's always a path forward. If I had a dollar for every doctor that said, tell me about their struggle and said, I thought it was just me, like I could pay my virtual assistant, right? And so it's not just you, like you were all walking around thinking that everybody else has it under control. It's just me, and it's not. And that you're never alone. Like there's so many people and doctors that want to help you. And from there's plenty of resources on the Dr. Lorna Breen site. There's Physicians Anonymous, the Emotional PPE Project. There's lots of resources, and that there is always a path forward.
That's really good advice, Kim. And I think those are all good resources as well. I'll try to link it in the caption because I think what happens is even if you're a physician and you recognize you need help, I mean, similar to Dr. Breen, you don't know where to go because the sounds it's so ridiculous, but you're afraid that any place you go to is going to report back to your employer, right? And that's going to land you in more hot water. And you said, burnout rates are about 50%. I personally think it's more than that. And I think
Mhm.
the reason that number is skewed is because people like it's taboo. You're not supposed to speak up about it. And so you don't. And I think when people don't speak up, everyone around them kind of just feels like, well, I can't speak up because my coworker isn't complaining. And there are some people who probably are happy. Everyone is a different personality, but I think for the vast majority of us who got into this for the right reasons, does feel that pressure quite a bit. And the only reason Shala and I can do this podcast, honestly, and this is also very sad, is because we're independent contractors. If we were employed by a health system, there's no way we could speak up like this. And I think it's really unfortunate that they do a good job trying to silence you. And I think that's done on purpose to kind of keep you working.
One doctor who was a guest on my podcast had a check with his healthcare system, and they had to sign off on it. And at first, I'm like, you're a doctor, they don't own you, But if you're an employed physician, but then there's like when you sign the thing, like about that you can't, if you leave, you can't work within 100 miles. So that's part of the thing too, is sometimes doctors do feel trapped. Yeah, it's a mess, and we have to find a way, and that's what I'm trying to figure out, how I can make the best impact to change things for doctors, because I just understand all of these things and it's just not right.
I mean, being trapped is the right word. Shala and I use that word all the time because by the time you get to a point where you realize like things are not fair or things are not right, you have a boatload of debt. You have to take care of a family for most of us. Um, and I think physicians also believe that they have no other discernible skills. So they're like, oh, it's too late for me to make a career change. So what am I supposed to do? I just have to live this out. And that's kind of when they start owning you, unfortunately. So you're very right about all of that. What kinds of systemic changes do you think are most urgently needed to try to rectify some of this?
So I communicate with a lot of people, doctors and other people that intersect with healthcare. And today I had a conversation. We've been communicating for about a year and a half now with Liza Nieko with the Patient Revolution. And just in our conversation today, she said that we need to keep people out of, or keep people not in the room, out of the room. And I love that, because she said you can even apply that to like the Epic or something, right? Like if a doctor is in the room with a patient, Epic is in the room too, and Epic doesn't belong in the room, right? Or with the prior authorizations, or with the insurance companies. Is that, I just think that kind of sums it up, is we have to bring back just that patient physician relationship, and to stop removing, as you guys spoke of, all the obstacles.
How do patients play a role in supporting the physicians or physician wellness?
So one thing I've been trying to do the last couple years is make a big impact on Doctors Day. And I even have done that locally. And then people in my own church will say, oh, I sent my doctor a thank you note, or I said thank you to my doctor because of you. So I've tried to share that. And so many doctors will say that they've saved every card, note, gift that a patient ever got them, and they keep them in a drawer and they take it out on the hard days to remember why they got into this in the first place. So, just even a huge thing is like patients have no idea how much gratitude it can mean to a doctor. And actually, even my own doctor, the last time I talked to him, he called me on the phone to thank me for my thank you note. And he said, patients like you are the reason I continue to do this. I'm sorry you're going through all this, but I'm looking forward to seeing you again. And I told him I was looking forward to seeing him again too. And he died 3 months later. So just a thank you. If you do nothing else, is just see your doctors as human. Know that they're doing their best, because I've seen like 1 star reviews, but the patient might write, I couldn't find a parking space, right? Or the person at the front desk was rude, but the doctor was great. But it's the doctor that gets the 1 star review. So for them to understand that the doctors have so much responsibility and so little control, real and perceived. So we all need to have empathy and compassion and understanding and treat each other with kindness.
I think there's a public misconception that we do have more control than we actually do have. And there's also a public misconception that we're like rolling around in like boatloads of wealth, which is also not true. Obviously, doctors in the grand sense of things do make good money, but if you put it in terms of the type of revenue we bring in for the hospital systems and who actually takes pieces of that pie, we're not that high. I think our salaries make up for less than 8% of healthcare expenditure. So I think, but we are the face of the healthcare system. So in that way, we get villainized. And I think the tides are turning a little bit. I'm seeing on social media when doctors post, there are people in the comments defending the doctors a lot more now, which is reassuring. But definitely, we do need more cross collaboration between doctors, patients, and other healthcare professionals. Like, for example, as MDs, we bicker a lot with APPs, like nurse practitioners and PAs. The reality is, we're all in the same crappy boat. We're all being taken advantage of. And so, definitely, I think we all do need to come together. And cross collaboration in that way is important for healthcare reform because there's there's a lot of power in numbers. So, what has kind of surprised you the most since launching a stand up for doctors?
Well, that's a very good question. Well, I guess just, in having these conversations with doctors, at first, even because Dr. Michael Hirsch had a blog that had showed up on my Facebook feed, and I followed it for like 9 months, and he shared that he was celebrating his year of blogging. So I used to only be on Facebook, so I sent him a private message just congratulating him on his year of blogging, and he sent me the nicest message back, which I guess surprised me because I didn't even know if I would hear from him. And then we started communicating, and I didn't know how to feel better. And I'm like, could I tell you the story of my doctor? I knew he coached physicians. I didn't know a lot about it. So when we hopped on that call, and I was like, oh my goodness, like a doctor will talk to you when they don't have to. Because, like I had already been through everything for like 2 years at that point. I had had the 3 cancers, all the surgeries, had all different kind of experiences. And we just had a regular conversation, just two people. So then I had been following Kevin MD and all of those articles for a year. And then some of those articles really resonated with me. So then I was like, oh, I'll send them a message. So I would, if they had an email address or a, link, once I hooked up on LinkedIn, I would send them a message, and they would get back to me. And then we would just have a conversation. So I appreciated that. And I guess that surprised me that doctors would take the time to talk to like just me.
I'm sure the doctor felt so good about that too. Because again, a lot of us, we don't want to be feeling like robots. We want to be able to like have regular conversations with our patients. Are you optimistic? Because Santushi and I are not. We are not optimistic, especially with AI, and that's another topic. With AI, we feel that everyone is talking, oh, how AI is going to help physicians and reduce time and this and that, but Does it really? And I don't know. I'm very, concerned about the future of healthcare and the doctor-patient relationship.
Well, there's absolutely pluses and minuses with AI. And as you said, that would be a whole other show, right? And even because one positive theoretically could be if you have like an AI person to take notes for you, then you really could, they could generate a note and then you could just review it. But I've been in a room with a doctor that used that and it was inaccurate. So it's not always accurate. But then I didn't go to the trouble, like, how do I correct that? Like, that is just a lot of obstacles that patients have, right? And then but then on the problem side with that would be, well, what if they figure, okay, well, now you don't need time to do notes because you've got this AI note taker. We're just going to give you even more patients. So that would be like the worst outcome. And that's just one example, right? There's so many examples. And also, like, say it was radiology using AI. What if AI gets it wrong? You can't sue AI, but then, right, if the doctor was told they're supposed to use AI, there's always like a doctor name on it. But what gives me hope is that since I've been involved in this space, that there's so many doctors on LinkedIn and other healthcare professionals talking about these things. And then Matthew Zachary is a patient who had cancer, and he started this whole We the Patients movement. He just came out with a book, and he's trying to have a groundswell movement of patients, which there's even cancer patients, there's like millions, right? And he's like, if we all stand up and demand better care, because when I interviewed Kevin MD for my 100th episode, he said at the end of the day, we all want the same thing, the best care for patients. And what I'd add is like, but not at the expense of the well being of the doctors and other healthcare workers. But I feel like there's so many people finally talking about it. And my work with some organizations such as Medicine Forward, we're trying to gather organizations for system change and bring them together to have some of these conversations so we can all move in the same direction so people are less siloed.
That's really great that you're able to do all of that, and it is for what it's worth. Even though Shala and I are not optimistic, I do feel some inkling of optimism when I see the younger doctors posting a lot more on social media, patients coming together and actually advocating, and other healthcare workers also helping speak up. It does make me feel like at least there's some advocacy there. I mean, we have a long ways to go because again, there's still physicians that are kind of stuck in the system, and I feel like brainwashed to a certain extent. That's the term I use because I think it applies here. Thank you so much for joining us. Where can people find you?
Well, I'm always on LinkedIn. So LinkedIn is one great place. I do have a website, standupfordoctors.org, and there's two tabs on there that are really good. So if people wanted to see the authors in our books, we have pictures of all of our authors with how you can reach out to them. And then I'm planning a wonderful physician retreat for doctors. It's going to be this fall in Ossining, New York, Columbus Day weekend. So there's a full agenda. You can see all of the speakers there. So my website is another way. I have a YouTube channel, Stand Up for Doctors, and those episodes are also available on like Spotify, Apple, Amazon Music. And I have a Substack newsletter, and it's all, if you Googled like Stand Up for Doctors or Kim Downey, any of those would likely pop up.
Any final comments, Kim?
I think maybe I would just reiterate what I said when we started, because doctors need to hear that it's not just you. You're never alone, and there's always a path forward.
That's great. Thank you so much, Kim. And thanks for the audience. Thanks for tuning in to Be Empowered, the podcast. If you enjoyed this conversation, don't forget to subscribe, leave a review, and share with someone who needs to hear this. Stay strong, stay empowered, and we'll see you next time. Thank you.